Welcome to the Kirby Connections Health Podcast, where we help you nourish your wellness journey with Kirby Medical Center. I'm Amanda Wild. On this episode, we'll talk about depression and anxiety in rural areas with Taylor Ferguson, Director of Integrated Behavioral Health at Kirby Medical Center. Taylor, thank you so much for being here to share your expertise on this critical topic.
Yeah, thank you for having me.
Taylor, from your perspective working in Central Illinois, what are the most common risk factors contributing to high rates of depression and anxiety in rural populations compared to urban communities?
They can be similar to those in urban, but just a little bit more impactful because we have things like just a limited access to just mental health care. We live in more stretched out areas. That increases travel times to get those services. Transportation can be a barrier. So then that makes it hard to be compliant with appointments and things that come with that. And also as a result of that, you can see an increase in isolation and loneliness because, again, with having these barriers or what we call social determinants of health, that just then people will just stay home rather than going out and taking care of themselves. And then in smaller towns and rural areas, stigma is still a big thing to try to get through. You have the mentality of everybody knows everybody. So there's, concern about privacy and confidentiality because they just, maybe I don't want that person to know that I'm getting healthcare services for counseling and for my mental health. So they just don't do it then because it's such a stronghold that we still continue to see.
So stigma and limited access actually isolates people even more. So how do you shape your programs to address that?
Yeah, so one of the biggest programs we have here is called Senior Life Solutions, and that was designed to target our older population, 60 to 65 and older, which kind of grew up at a time where we don't talk about emotions, we don't talk about our feelings. So in the last 4 years of me being here, we've done a lot of community education, a lot of community outreach to educate that it's okay to get help and it's okay to seek services. And we do this in a group therapy modality so that they're around other individuals who have gone through or are going through similar things so that they realize that they're not alone. And that has been a very impactful program here in our community.
So you are addressing the social stigma and cultural attitudes. Are there also socioeconomic or occupational stressors like farming pressures or job instability that seem to play a role in triggering or worsening mood disorders?
Yes. I mean, all of the above. Much of the rural community, especially here in Monticello, is farming, is agriculture. And a lot of that, is also now dependent on external factors, the weather, things that go along when it comes to farming, drought seasons, raining, things along those lines. So when we have a more wet season, that can impact the crops. If we have a more dry season, that impacts the crops, which then impacts, financial strains. So it's really kind of just all the above. And then, of course, governmental policies can play a role in all of that and all the fluctuations that come with that. So a lot of those uncertainties can continue to persist as stressors and triggers that go unaddressed.
And how much can lifestyle factors like physical activity or diet, sleep, substance use help or manage depression and anxiety in these communities?
The physical health and having a strong diet are always, the recommended diet, and rich fruits and vegetables and lean meats just kind of help promote a healthier overall well-being. And then engaging in physical activities, it doesn't have to be the strenuous things like CrossFit or marathon running or triathlons, but, going for a walk, being out in your garden, just doing yard work or what we call like ADLs, just your daily living necessities just to kind of keep your body moving, but then maybe integrating some little strength training. So lifting weights maybe a little bit just to kind of keep up that muscle tone, but it doesn't have to be the most strenuous thing in the entire world.
Right. I hear that. And I have read that even just spending a few minutes in the morning outside grounding yourself can make a huge difference and inspire
Yeah.
you to do more of those self-care type of things.
Yeah.
Are there community-based programs, support groups, or faith or school-based initiatives that you've seen make a measurable difference for rural residents?
We continually work on that. One of the things that rural hospitals do are called community health needs assessments, and those are done about every 3 years. And that, we survey the community on what these needs are and how can we as a hospital organization and the community come together to help address these. Some of the things, that we have here to promote mental health, to promote physical health, are like our primary cares. We have individualized therapy located in all the clinics. Of course, Senior Life Solutions that I talked about. We do have our own KMC Move and KMC Active to kind of help promote that well-being. We have a wellness program for wellness coaching. And then, of course, we do a lot of work in the community. Over the last 2 years, I helped develop a health and wellness program for our local junior high 7th grade health classes that we co-teach. And we talk about just the basics of overall well-being using what's called the wellness wheel that it integrated 8 different dimensions of health. And then we couple that with basic kitchen sessions. So I worked with our dietitians to then talk about just the basic how to be in the kitchen and things and cooking and the basic necessities of that. So that's been a fun little project, just to name a few things that we have going on.
Yeah, so rural healthcare systems can integrate with community systems
Yes.
or existing public health programs. Do you do
Yes.
that also for chronic diseases like
Yes.
cardiovascular conditions or diabetes? Yes?
Yeah, one of our subcommittees related to the CHNA Community Health Needs Assessment is targeting chronic diseases such as hypertension and diabetes are the 2 big things that we are currently working on in that spectrum, because that came out to be the 2 biggest things that we are seeing amongst our county and community.
And as we look at early detection for depression and anxiety in rural communities, is there a role there for AI or mobile apps that I've heard about?
There's a lot of research out there. None of it's been like concrete, but you have things like the Calming app, which I talk to my patients about just to kind of help teach you or keep you in line with the things that you're learning in therapy, to do the grounding techniques, do the mindfulness meditations, and things along those lines. That's the biggest one I kind of talk about. I haven't really delved into many of them at this time, but I know that as, we continue to advance, that technology is going to continue to grow. And I think there will be more alternatives for that.
There's so much you're doing to support people suffering from depression and anxiety in your community. How can family members and caregivers in rural households be better educated to recognize early warning signs and provide supportive care?
I think open-mindedness is a big thing. So just being open to mental health. So kind of getting around that stigma and, not being afraid to have those conversations. One of the things that I work on through our high school program called Pathways is it's okay to say words like depression. It's okay to say words like suicide. That you're not going to put that in their head, but you're going to open that conversation and you're going to provide a safe space and a non-judgment, a judgment-free zone to have open conversation about things. So just being open-minded, I think, is the biggest thing. You don't always have to know what to say back, but just being a listener can honestly do so much, more than some realize.
So true. Listening. Very simple things, like you said, can really make big changes. Taylor, thank you so much for this in-depth look at recognizing and responding to depression and anxiety, and specifically shining a light on our rural communities.
Yeah. No, I'm excited to be here today.
For more information, visit kirbyhealth.org/services/mental behavioral health. And if you found this podcast helpful, please share it on your social channels and check out our entire podcast library for topics of interest to you. This is Kirby Connections Health Podcast, presented by Kirby Medical Center.